We're one small piece of this evolution that's happening in healthcare. We're supporting other entrepreneurs who are making healthcare better for the masses, and it's exciting to see.
Jonathan is the CEO of Cerbo, the leading EHR system built for functional and integrative medicine. From a small idea helping a few doctors to powering over 1,000 clinics across the U.S., Cerbo has become a multi-million-dollar platform, changing how healthcare is delivered. He's proof that success isn't just about scaling tech. It's about building tools that actually make medicine human again.
Over the past 5 years, there's been over 240% growth in direct pay, cash-based, membership-based healthcare.
Why do you think so many practitioners are moving away from insurance and more towards cash-based models, regardless of the type of medicine they practice?
My observation has been that a lot of doctors, clinicians, providers are just getting burnt out from that model. And with the tools that are generally available being focused so much on insurance, and that's the model that the providers are trying to move away from into a cash-based approach, that EHR just doesn't fit the needs of what they're trying to accomplish and how they are trying to deliver healthcare to their patient population. Anyone who's in the medical industry understands this, that the incentive is more volume-based than really spending the time to understand what are the core issues that is ailing this particular person, and then what are the changes that need to be done holistically to reverse chronic condition, relieve pain, or to just get them to live their best life. In our space, it's all about data, getting information, and having a purpose-built tool that's really aligned with what does the doctor need to help promote the best outcomes for that patient. It allows you to have a more efficiently run practice. And that's where you can become more scalable. When I think about workflow excellence, it's really around these 5 pillars: intake and data capture, documentation, patient engagement, billing and payment, and practice management.
Each of those pillars is going to carry through your ability to actually scale, operate, and again, generate good patient outcomes. Anything else is just going to provide more friction. Welcome to the Freedom RX podcast. I'm your host, Seth Conger, and today we are having a conversation with one of our partners, the CEO of Cerbo, the leading EHR, electronic health record, in the functional and integrative medicine space. So this is a technology that is absolutely at the core of how practitioners function in their day-to-day workflow, whether they have a brick and mortar facility or a virtual practice. And we're going to unpack quite a bit. We're going to talk about the electronic health records. We're going to talk about how Cerbo is different and kind of leading the pack in innovation and technology. But we're also going to talk about the generic EHRs out in the market and why they don't fit the functional or integrative medicine workflow at all. We will also discuss certain features and functions along the way, some best practices and tips for administration and other areas of efficiency. So again, Jonathan, thanks for being with us today. This is going to be a really fun conversation. I know that maybe some people don't find technology and data collection and charting as fun as I do, but from being in clinical practice and knowing how big of a part this piece of technology actually plays in the overall operational efficiency of the entire organization, I'm going to find this conversation quite fun. So Jonathan, welcome to the show.
Thanks again for the invitation. Once again, Cerbo, we really appreciate the partnership with Freedom Practice Coaching and how we all collectively are just one small piece in the healthcare movement that is more of a cash-based approach in integrative and functional medicine. And we just can't let you know how much I appreciate this opportunity to geek out a little bit with you today.
Amazing. So you teed me right up there, Jonathan. The cash-based approach, right? This movement in healthcare that we've seen for quite some time, and I feel is actually picking up a whole lot more steam in many cases because technology companies are now starting to pay attention to it and creating some enablement for the practitioners. So I kind of want to start with from your seat, right? From my seat, I really see things on a business coaching, operational, team building side of things. You get to look at it from a technology lens. So from where you're sitting, why do you think so many practitioners are moving away from insurance and more towards cash-based models, regardless of the type of medicine they practice, whether it's integrative, functional, naturopathic, holistic, alternative, health coaching, you name it. Why do you think so many people are moving away from that insurance model?
That's a great great observation, and I agree with that trend wholeheartedly. And let's go back a little bit to around 2010 or so with the High Tech Act, kind of coming out of the Bush administration into the Obama administration. There really was a push for EHR adoption for a lot of interoperability, security reasons, and such. And so when you think about where this industry, even before then, there was a lot of movement towards that. But that's really where there was a government incentive to really promote the adoption of EHRs during that time period. And at its core, really was around reimbursement and insurance, kind of the third party players in that, and making sure that you had the checks that cross your T's and dot your I's to get reimbursed. And that's really what the purpose of it was at that time. Over time, my observation has been that a lot of doctors, clinicians, providers are just getting burnt out from that model. And with the tools that are generally available being focused so much on insurance, and that's the model that the providers are trying to move away from into a cash-based approach, that EHR just doesn't fit the needs of what they're trying to accomplish and how they are trying to deliver healthcare to their patient population. And so that's really where an opportunity came for more of a vertical focused EHR that takes the inputs of what those providers are trying to deliver, how they're trying to deliver it, what are the parts of the ecosystem. So when you think about the partnerships and integrations that are needed to deliver that in a way that allows them the flexibility to offer and deliver healthcare in the way that they feel best and that their patients also are expecting.
Yeah, so it's really interesting, right? It was almost a forcing function with the electronic health records to go away from these paper charts. And I still remember, I mean, I've gone into a few offices recently that still have the giant rolling cabinets right behind the front desk, where you can still see the charts that are all stacked in there, and these like paper charts from years and years. And it's kind of crazy to think about. A, some people still have those in their office. B, it was not just a decade ago or slightly more that was a regular practice, right? And it seems quite archaic to think that your medical record as a patient is kept in this paper form in a binder stuffed in with a bunch of others. And if somebody needs to get information from a different provider that you go to, they have to phone in fax to get that information, right? So we shifted from that model over to an electronic health model. But again, there was so much friction in that. It was really more, I would say, from my perspective, most of the electronic health records were built with a huge focus on billing, right? Billing and coding as kind of like the main area of, if we can get this right, it doesn't actually matter if the user interface or the user experience is that great, because at least we're going to get the most optimized billing and coding system together. That just doesn't matter when you're taking cash, right? So it's a completely different model, and we'll get into functional and integrative models, which are even more different than like a fee for service cash. But just give me a little bit more on that shift there, right? That shift between insurance to cash, and what are the areas? What are those pillars, and what are those workflows that are critical for cash that may not be on the insurance side?
Yeah, absolutely. And just as another data point, so there's somewhere over 1,000 EHRs currently in the market. In less than 1% of them really serve this market. And so that just shows you, to your point, that really the focus is around revenue cycle management, coding, putting in the correct codes, and getting the appropriate reimbursement for the services. And as anyone who's in the medical industry understands this, that the incentive is more volume-based than really spending the time to understand what are the core issues that is ailing this particular person, and then what are the changes that need to be done holistically to reverse a chronic condition, relieve pain, or to just get them to live their best life, which is why they're there. So that's unfortunate, the system that we are today. And I know Charlie talks a lot about that as he's speaking about the different models that are out there. And so because of that, you kind of can remove that from this the equation of what you're trying to solve for. So if I remove the part about making sure that I'm asking about smoking, I'm asking about all these other things that aren't relevant to this particular patient, then I really am more focused on, well, what are the labs that I need to integrate with? And am I able to do that in a way that I'm not clicking between different windows? I can order the labs within the system. I can review the results within the system. I can share those results electronically with my patient and discuss that through them. I can change what is a high or low value on those lab results. So that way, when I'm sharing something with my patient, it's from what my viewpoint of them coming to me as the doctor and guiding them through their healthcare journey of what that looks like. There's other things such as the patient portal and communicating with the patient. So is it easy for my patient to set up appointments? Do they have to call the office to do that? Or can they do that and self-serve on their own? And having a tool that makes sure that that is something that can be done. Questionnaires in our space, it's all about data, getting information. And are we still, to your point about paper, does someone have to come into my clinic, have a clipboard, as we all know, the clipboard and paper that you get handed when you walk in through the door, and having to check and have to remember all of those questions about your past medical history? Let's put that electronically and give that to the patient ahead of time so they can sit down and really think about their answers, because the best results you're going to get with the data that comes in. And so those are just all parts of what makes this approach to medicine, very unique, and having a purpose-built tool that's really aligned with what does the doctor need to help promote the best outcomes for that patient. And we feel that small part of that equation.
Jonathan, you said something in there that was really, it may have been brushed over by the audience, and I kind of want to come back to it because I think it shows very clearly how Cerbo is thinking about the needs of the practitioner. So you said in lab values that are inside of Cerbo, you can actually change the highs and lows. You can change the lab values there so that when you're sharing that back with the patient, it's within the ranges that you choose as a practitioner rather than the default ranges of the lab. Such a small thing, such a massive pain point for functional and integrative providers, right? Like how can you possibly show a patient that you're practicing something different with different ranges that are built for optimal health, right? Not disease-based care, if the paper that they're reading on says, oh, you fall within the normal range that is the bell curve of 80% and has nothing to do with optimal health. I kind of want to jump into that for a second because I think it's such an important point. Like, at what point did Cerbo decide we're going to make changes in these overall lab ranges or allow practitioners to do that?
Yeah, absolutely, Seth. And this really goes back to the genesis of how Cerbo became to be. As you know, with any business, you're solving a problem that's not being met in the market that you serve. And that was one of the many things. You mentioned how it's something that now we kind of speak of as just a small detail footnote, but it is a big thing that really goes back to the foundation of why Cerbo was created and why Cerbo has really grown alongside with this industry in this space, is that we do listen to our customers. We do take the feedback, and we're try to be as smart as we can about implementing that in a way that's really serving the population that we serve of the cash-based world, where those type of things, to your point, are not in necessarily the mainstream approach. The test still needs to be done, but what does that mean, and how am I explaining that to my patient may be different than a general practice mainstream medical provider. And so that's just one example, as you said, of the many ways that we've been able to create and serve the needs of our space.
That's so great. So, looking at, we talked a little bit about the insurance-based EHRs, over 1,000, right? 1% serving the functional and integrative medicine or the cash-based population, which is crazy numbers. How do you know, as a practitioner, how do you understand if a EHR is restrictive to your workflow or not, right? Because I think this has not been an extremely exciting area. Practitioners have believed for a very long time, at least what I've heard, not talking about Cerbo, but many other tools out there, they just deal with the problems, right? It's an expectation that their electronic health record is going to be a pain in the butt. It's going to constantly have issues. They're going to be on with support, but it's just part of doing business, and it's something they have to deal with, right? So when you normalize chaos, and we talk about this a lot on the business coaching side, when you're in chaos for long enough, you end up normalizing it, and you believe this is just the way it is. This is my new normal. So you just deal with it. So I think a lot of the practitioners listening to this who are not on Cerbo or haven't had the opportunity of using a really well functioning EHR may just feel like this is the way it is. So how can you tell when your EHR is actually being restrictive?
Yeah, I think one, you do your research ahead of time and ask for your friends. One of the beautiful things about this community, and I use the word community very intentionally because we're just one piece of a growing movement to where I will sit here and sing praises of Cerbo because I do think that we do the best job of serving the market, but ask our customers, ask your friends about their experiences. And that's where the real excitement happens because of the flexibility our system provides. You can start learn from others about a problem you have that someone's already solved. And that's where some of this chaos, normalization of chaos can be done away with when you learn from each other in the community. So there's Facebook groups out there I'm sure people listen to here are aware of. And there's other communities that I'm not even aware of for that, where you will hear stories upon stories of how Cerbo has been able to just create a well-oiled machine for their practices in the way that we can use chart parts to streamline a lot of repetitive tasks, how you can set up certain workflows and automations in Cerbo that just allow you to no longer have that problem anymore. The problem just kind of goes away because of the way that it's been implemented. For example, Campbell Family Medicine, one of our customers in Georgia, they really have a really interesting way that they use chart parts and how it's just relieved, I believe, about 10 hours a week from manual tasks, just being able to use some of the functionality that we have in that way. And I can go in later about what that looks like in a little bit more detail, but those are just some examples of how providers have been able to use our technology to spend more time on the patient. Let's get rid of some of the administrative tasks. And we've listened to our customers over the years, and we'll continue to listen to our customer as in the coming years of what that looks like so that you can do what you came down this path to do, is to focus on the patient. And we're just a tool and a way to help you administer that in the best way possible.
So cool. 10 hours of workflow time savings. You know, Jonathan, when I think about technology, when I think about operations in general, right, technology being a part of it, I like to encourage our practitioners that we coach to think first about the people, right? So do you have the right person in the right seat? Are they skilled enough? Do they have the talent? Do they even have the experience at a certain level to do the job that you want them to do? From there, it's about process, right? So it's the process that is going to enable that person to be more efficient at their role and make sure that they're more accurate on a day-to-day basis with all the tasks that they have in their roles and responsibilities. And then we have technology, right? Technology being the enablement of process and of those people, right? So people, process, and technology. And you talk about this, you know, the workflow, right? And the workflow excellence. I think it is such a critical part that people miss out on because they're not thinking about that technology enablement of the processes that they have. Maybe they've never thought through the processes in general, right? Or how am I going to support the people who are working in our environment, in our practice, and making sure that they have the most efficient and effective tools to get their job done. So I know Cerbo talks about the pillars of workflow excellence. Can you walk us through each of those pillars so we can really kind of see how Cerbo thinks through this whole ecosystem to benefit not just the practitioner and the patient, but actually the entire team using this tool?
Seth, I think that's a great question. When I think about workflow excellence, it's really around these 5 pillars: intake and data capture, documentation, patient engagement, billing and payment, and practice management. And we can really spend some time going into a little bit more detail on each of those.
Great. Yeah, let's I think intake is a really interesting area because, you know, as you mentioned earlier in the conversation, there's the clipboard, right? You walk into a front office, maybe you're lucky if they say hi to you before handing you a clipboard. And that clipboard has a bunch of pieces of paper. If you're like most individuals, you're not cruising in with 20 extra minutes before your appointment. and all of a sudden you're setting off the workflow for everybody. So what Cerbo allows you to do is actually eliminate the clipboard. How do you guys think about doing that?
It starts off with your intake process. And everyone wants that situation to start off on a good foot. And when we have these digitized forms and you can get that in the patient's hands ahead of time, it removes the stress of coming in for your first appointment, especially for the first ones, and having 100 questions of past medical history, having to recall all of this information about past doctors and medications, then or other symptoms of how you felt over a long time period when you show up to the clinic. So to avoid all of that, you can put that in the patient's hands electronically prior to the appointment, and you can have reminders for them to fill that out before then, so that when they do show up, not only is the patient in a better place, but the doctor is also well prepared to have a more in-depth and have a deeper conversation, especially when it comes to the past medical history and addressing the situations that you're there to get fixed.
That's great. I mean, that's such a huge time savings for the practitioner, right? And it's such a better process for the patient too. I mean, I can remember sitting in a waiting room, having to fill out all this paperwork, trying to remember my own history, my own medical history. Did I have surgeries? Was I a C-section or a natural birth? Like all of these things, these questions been sprung on me. And I'm sitting there where I could have easily accessed this information if I was sitting in front of my computer at home, right? So just being able to do that is actually quite an advantage for the patient and the practitioner, who can then review the paperwork beforehand, right? And actually have time to sit with that, which is really important. I think the same is true with labs. Can you explain your lab process and the integrations that you guys have at Cerbo, and how you're kind of solving that same problem versus patients walking in with a photocopy of their labs that they got from LabCorp?
Lab work is a really big part of this industry. As we know, we want to gather as much information as we can to make an informed decision to create the best outcomes for the patients. And we integrate with over 40 labs. Many of them are specialty labs, purpose-built to serve this community once again. And we do this in a way that's also electronic. And if you have an unintegrated lab, one, you're creating an additional workflow friction on the practice side, where you're having to log out of Cerbo, log in, open another window, put in a lab, potentially download a PDF once those lab results come in, upload them into Cerbo. With having an integrated solution, you don't have to leave Cerbo. You can order those labs within our system. Those lab results come into our system, and then we can take the information off of that PDF that comes in and put it into part of our system. So now you can interact with that information and pull it into your chart parts by using our chart parts solution that we have to manipulate that information and use it as you need. And once it is in our system, you can then share those lab results electronically with your patient through the patient portal securely. And if there are questions, that can be handled in a HIPAA compliant manner through our secure messaging. And if there needs to be a follow-up appointment, then that can be done within our patient portal. So once again, this is where you're removing other hands that have to be involved and making it all seamless in one system and one experience for your staff and for your patient.
That's so cool. I mean, what a time savings, what an operational efficiency. Jonathan, you've mentioned chart parts a couple times in the conversation so far. Give me a breakdown of what that is, because I know this is a feature that is pretty core to Cerbo, and I haven't seen it in many other EHRs. Maybe some are copying you guys at this point that I'm unaware of, but it's a pretty fantastic feature that I think creates a lot of efficiencies. Can you kind of just like go back to the basics and tell us a little bit more about what chart parts is and what the overall use cases are?
Absolutely, Seth. So chart parts allows you to put a pre-populated, defined, call it a short list of very common things that you do within the system. So if that's certain text that you put into a patient's note, if it's certain labs that you order, if it's certain charges that you have as part of very common things that you charge for, whether that's an appointment visit or a certain type of different services that you have at your clinic that you provide, certain diagnoses, certain prescriptions, vitamins, supplements, handouts, all of this can be done in creating a short pick list that you can then further select the most common ones to add to your note or create actions that are handled within Cerbo. And so depending on a certain type of patient that you see, if there are certain things unique to that type that you see, and you can create type A, type B, type C, and then within each of those have certain unique things that you need to have done, that saves you time from having to pick from the universe of things that you can usually select from within the system. And that just saves you a lot of time from pre-populating how your notes look like. You can pull in certain things from the patient's chart and history. So questionnaire data, any forms that they've completed, you can pull that into your note and have that come in a very smooth manner within chart parts. It allows you to really just have a more efficiently run practice. And that's where you can really become more scalable, Seth, is once you create chart parts, that's kind of the best practices that you have at your practice. And then as you're training your staff on that, then you're kind of recreating that same workflow to where you can create the system and staff up your team, and they're all doing the similar process across your practice.
It sounds like you guys have really thought through how charting works in the functional and integrative space rather than trying to fit charting into an old model. We talked about longer visits, talked about the intake, right? Pulling in the labs. There's a whole section of supplements and the integrations with supplements as well, since those are kind of the medications of the functional and integrative space, right? And in conventional EHRs, there's a huge section for medications because that is one of the primary things that they care about. Obviously, Cerbo also has medications in there, but our doctors are trying to deprescribe, right? So the supplements become a really important part to that. So all of this information, it sounds like you guys have really thought through the efficiencies for the staff, really thought through the efficiencies for the practitioners so that they can spend more time with the patient rather than more time charting and looking through faxes and dealing with paper documents that may or may not be accurate. But technology is also bridging the gap between the provider visits. And I know that Cerbo's really put a lot of thought into that whole user interface and the experience between the visits. So how do you think about technology bridging that gap for the patients and the providers?
Absolutely. The gap that you're referring to, the way that we've helped fill that and the solution that we have is really through the patient portal. And so between a visit and when the next visit, there's a lot of things that have to happen. So there's likely a lifestyle change has been recommended. There's likely some medications or supplements that have been recommended. And it's up to the patient to really take the charge on making sure those things happen to get the outcomes that they desire. And this is where the doctors and our providers can send educational material through the patient portal. If there are any questions that the patient has as they're going on their journey, they can use the patient portal to communicate back to either directly with the provider or with someone on the provider staff. They can have health coaches that help with nutrition and other services they may have. They could have health coaches that help with either psychologically. They just need someone to talk to and just to help push them to continue on whatever their journey is. And that's where the patient portal really provides that access point for the patient to continue to get back to the provider and their staff to get the assistance that they need to get the outcomes that they ultimately desire.
That's so cool. I mean, it's really from almost like pre-patient engagement all the way through the entire workflow of outcomes and outcome reporting and generation for that patient. But there's also an important part in there that's called how do you get paid? And this is how the practitioners end up having a business, right? And if you're not leaning on insurance, billing, coding, revenue cycle management, then billing is a very different thought process in the areas of functional integrative medicine, whether you're doing programs, memberships, fee for service, a combination of all three. How does Cerbo optimize in the whole billing and collection process?
Absolutely, Seth. And as you eloquently put it, this is a different model than how traditional healthcare has been administered with insurance providers. And with that being the case, at its core, cash-based, we do make it easy for patients to have a card on file through the patient portal. So you no longer have to call the clinic to make that change. You can self-administer that by logging into the patient portal, putting in bank information, credit card information. Oh, by the way, I lost my card. It needs to be updated. You can do that on your own self-service without having to go out your way and call a clinic to have someone do that on your behalf. So we make it easy there. And if you need to call the clinic to make that change at the clinic level, you have the ability to make that change within the system there. And to your point, Seth, about the different models and what they look like as far as membership and packages, these are different approaches to how traditional healthcare is administered. And we have a solution for that to be able to meet the business model of your choice. And we're seeing the business models change and morph over time. There are different services that are being added. So you can kind of get into IVs and peptides and some of those exciting hormones, BHRT, that people are introducing and there's a need for. And we're adapting to that and providing ways that not only the functionality to administer that, but also the billing side of things in a way that's most aligned with what the practices are doing to serve their patients.
Amazing. Jonathan, you and I have had side conversations at conferences that we've been at together, at the Freedom Practice Coaching quarterly conferences, about technology really being this enablement for teams, for providers, about the business structure and how critical that is to have a smooth run operations in order to be able to actually pay attention to the patient, right? And get them the best outcome that they want, because that's most practitioners that I talk to, that's really what they want, right? They want more time with the patient. They want less things that they have to deal with, less technologies, less people in general, right? If they can have less staff members and still get the job done, that's actually usually quite a preference, right? And Cerbo has been quite the innovative company since you took over. I would love to talk a little bit about some history, and then B, maybe right after that we jump into the future. So a little past and a little future, since we've been talking about the present so much. So you're not the original founder of Cerbo, but you've been quite the entrepreneur. And you saw an opportunity here to have a advantage in a space and help out a lot of people. So I'd love to hear just a little bit about that history of how you came to Cerbo in the first place. And then let's talk about the future of Cerbo going from here.
No, thanks for that question, Seth. So my wife and I actually acquired Cerbo about 3 years ago. We had our own entrepreneurship journey of looking for a business to buy. We had a professional career in oil and gas for about 10 years and decided to do something very different than our friends and peers and wanted to buy a great business in a great industry. We did a lot of research on various industries, went really deep into the functional and integrative space. We ended up meeting a lot of service providers, many clinics themselves, and came across Cerbo and was just really excited about the problem that they're solving and this space in general. We've come to learn since we've been here at Cerbo, we are really supporting a lot of entrepreneurs. Once again, this model, this movement is a very entrepreneurial path for many of our providers and customers. And as I've gone to conferences alongside with you and other conferences, we meet the husband and wife teams from that perspective. And so that's our own journey. And every day that we go to work, we're supporting other entrepreneurs who are making healthcare better for the masses. And that's really been our journey so far with Cerbo. And it's been a blast. Every conference we go to, I get to meet current customers. I get to meet prospective customers. I get to hear about the lives and impacts that they have. And even though there are days when I get to work and it's tough and it's hard, really what it comes down to, what keeps me going and what keeps our team at Cerbo going is that, and I may have said this earlier, we're one small piece of this evolution that's happening in healthcare, and it's exciting to see. And that's just what we know of today. The future is bright. I'm sure you see it from your point of view, Seth, on the Freedom Practice Coaching side and some of the other things that you're also involved in. But yeah, I just can't say that enough how excited we are about this space and just how we're supporting these wonderful providers out there changing the world for better.
Love that. So Jonathan, if a practitioner is considering making a change, right? We already talked about the normalization of chaos. If you're in that right now, and in my clinical time of 5 years in North Carolina at the practice, we actually switched EMRs 3 times, which was a horrible experience every time, over and over and over again. And even the last one was unfortunately not where we wanted it to be for the type of practice that we had, with memberships, with programs, with supplements, with labs coming in from multiple different areas. Unfortunately, Cerbo was not a thing. And I would have jumped on it in a heartbeat because I've seen it. I see so many of our practitioners using Cerbo as their trusted EHR, and just like how happy they are with the system, how many problems that I used to have are being solved by technology. But it's also not for everybody, right? And typically, Cerbo it's a pretty robust EHR system. And if you're a part-time, 1 day a week health coach that is doing this as a hobby, there may not be the return on investment that you need for Cerbo, right? But if you're a serious practitioner and this is your livelihood, then really thinking about using this as an enablement tool for yourself, for your team, for your patients, I think is a critical step. So for those practitioners out there who are thinking about choosing an EHR, whether it's their first time, right? They're brand new and they're just going into practice, and they're thinking about getting started on the right foot, or they're being restricted by their EHR and they need to make a change. What questions should they be asking themselves? And what questions should they be asking those other EHR providers about what that system can do for them?
Yeah, absolutely. And Seth, before I get into that question, like what's really happening here is that over the past 5 years, there's been over 240% growth in the number of direct pay, cash-based, membership-based type healthcare businesses that are out there. And so that's really what's driving a lot of the questions that you're having when you're looking for a solution that serves, going back to, as we talk about, purpose built for this specific community. And so some questions that would naturally come to me are labs. What type of labs do you integrate with? And when you say integrate, what does that mean? Does it mean that I can only order labs? Can I get those results in? Further question, when those results come in, is it just a PDF? Is the information off that PDF able to go into the system that I can interact with? So that's one big question that we hear a lot of that is lacking across the space, because you can still have a lab account and your EHR and operate them completely separate. And we go back to the use case where you have to download a PDF, upload a PDF, and it's still only a PDF. So where am I going to get that information into my clinical notes? Aside from that is understanding the billing component. What does that look like? Do I have to manage the card on file information, the credit card information for my patients, or can they self-serve and do that themselves? That's really almost a full-time job in a lot of ways if there's a lot of changes with your billing information. The last and biggest thing, from my view, for integrative and functional medicine specifically, is just around the forms. Can I edit in my own forms? Does that information come into the system that I can then interact with? Once again, with Cerbo, for any form information that a patient fills out, that can come in through a chart part, and you can pull in the information that you need from there. And these are just a couple of the really big pain points that you'll come across when you're going down the path of cash-based medicine for this space specifically, that I think we do a really good job of. We're going to also always improve upon those as the landscape changes and the needs of our providers change. But those are a couple of questions that I would start with.
Amazing. That's great. So if you're listening in, any EHR, or, it's also sometimes called EMRs, electronic medical records, providers that you are speaking with, these questions that Jonathan has just served up, I think is going to give you a really clear answer of if that tool is going to work for you or not in whatever model you're choosing in functional and integrated medicine. And I really cannot urge you listeners enough to take a very serious look at this section of technology, right? When we're talking to providers right at the very beginning of their business coaching journey, right, or the consulting journey, one of the first questions we ask is, what is your model? Because the model is the absolute critical element to your scaling ability, right? We want to know if you're insurance-based, if you're cash fee for service, if you're memberships, if you're programs, if you're a hybrid of a number of those, because where you're going to get to in the future, how we build your team, the technology we think about, all of those things are associated with what model you have chosen. The next step is really going to be, how are you going to think about that base technology? What is the core technology or the source of truth, the area that your team is going to be working in the most amount of time? And we are a technology-based society. All of these businesses in the cash-based space are using technology, whether that is for document storage, for communication, obviously the electronic health record, phones and communication systems with that, and then so many other pieces. Finding a technology like Cerbo that sits in the center and can be that place that your team is in and out of all day long, that is HIPAA compliant, that is secure, that also has a good user interface and user experience for your team and your patients, is a critical decision that you need to make at the very beginning. And it is going to carry through your ability to actually scale, operate, and again, generate good patient outcomes at the end of the day. Anything else is just going to provide more friction along the way. So, Jonathan, I really just appreciate the care that you and your team has for this patient journey and the practitioner journey. I think it's amazing that you are coming from an entrepreneurial background, right? Same thing with me, right? We're coming from a business and entrepreneurial background where maybe we were not a doctor, maybe we didn't have a healthcare background, but we see how we can enable these practitioners to do a more efficient and better job with their patients and their teams along the way. And if that can be our part in affecting this change in medicine, then that's an amazing thing that we get to do. And I think it's those perspectives from all different backgrounds that are really going to help bring the most efficiency and the best outcomes, and for the practitioners, better time utilization, better profits, all of that in the multidimensional realm of profitability. It's going to bring that back to them. So I really just thank you and your team for tackling this huge challenge that's always been a thorn in the side of every practitioner I've talked about, except for those who are using Cerbo, which are so many of our practitioners at Freedom Practice Coaching, and many others in the space. So again, thank you for that. Is there anything else that you'd like to share with the audience? Maybe a direct line of contact to a member of your team if somebody's interested in Cerbo, or anything else?
Before I answer that question, Seth, I just want to kind of give some accolades back to Freedom Practice Coaching. Once again, being an entrepreneur, you have to understand and accept the fact that we all need help. You kind of, being an entrepreneur, you have that fire, you have the idea, you have the drive, but you may not necessarily know the how. And I always recommend for people to get help, business owners, the entrepreneurs in this space who I come across that have questions. And I get asked questions sometimes where I'm like, well, I don't know if I have the answer to that, but I know where to send you. So if you're listening to this and you're considering this path, lean in, keep asking questions until you hear a really hard no. Because sometimes not all no's are hard no's. They're just kind of like, I need to kind of work around that to get to the yes that I'm really looking for. And Freedom Practice Coaching, I believe, is a great place to start. And a great community, part of our community. This is a really huge growing community in a lot of aspects. And Freedom Practice Coaching is doing a great job with helping people go down the path of having a better life as a provider and also having a scalable business and not just a job. So if you have more information, reach out. You can go to our website at cer.bo, Cerbo, and you can go click on there and find a way to reach out to one of our salespeople who will be glad to hear you out. And just if you're going down your journey of looking for different EHRs, as Seth mentioned, it's not uncommon for people to switch EHRs. It is a daunting task, trust me, but we help people every day with that transition to make it as smooth as possible so that you can get back to what matters most. And that's changing healthcare for the better.
Great. Jonathan, thank you so much. It's been a really great conversation. I've been looking forward to this one for quite some time, diving into the area of technology because it is such a critical component of if a practice feels restrictive or if a practice feels proactive. And that's really where we're trying to get these businesses to, because that just makes everything easier across the board. If you've been listening to this and you want to hear more discussions like this one with Jonathan, the CEO of Cerbo, one of our coaches or members of our team, or even the interviews that I do with our clients, please subscribe. If you're on YouTube, you can just click the button right below this. If you're on Apple or Spotify podcasts or another podcast platform, just go to where it says follow or subscribe for more information and more conversations just like this one on the Freedom RX podcast. So thank you again, Jonathan. This has been an awesome conversation. I'm looking forward to likely a part 2, maybe a year from now. We'll go over all the new features and functions that Cerbo has and all of the other challenges that you guys are taking down one by one. And again, thank you, audience and listeners, for being here today. This has been another episode of the Freedom RX podcast.